Are you looking for a different type of healthcare to address your thyroid disorder or autoimmune condition? At Holistic Wholeness Institute, we practice something called functional wellness. Functional wellness is concerned with the root cause of healthcare issues, not just symptom management. Consider this. If you had a rock in your shoe that hurt your toe every time you took a step, what would you do? Would you just take an aspirin to relieve the pain? Or would you address the underlying problem and shake out the rock? You'd remove your shoe, of course, and that's a great metaphor for functional wellness. At our clinic, we're passionate about helping our members remove the rock to become empowered and independent. We're going to start that process right now by educating you on America's healthcare crisis and helping you understand how the system is failing patients. We're going to dive into a functional wellness approach to thyroid health and autoimmune conditions and discuss some of the potential underlying reasons why you're not feeling your very best. And at the end, we'll give you a fantastic opportunity to book a one-on-one consultation to become a member at our clinic. At Holistic Wholeness Institute, our lead practitioner is Dr. Nancy Beliveau. She knows what it's like to not be listened to and was a victim of the broken healthcare model herself. She was given pills for every ill, only getting worse, masking the symptoms, not getting to the root cause. She helps her practice members to feel seen and heard. Each program is customized to the person and includes everything they need to help them feel their best again, naturally and effectively. Is there a place for conventional medicine and pharmaceutical drugs? Of course there is. If I were to get into a car accident on the way home from work, don't take me back to Holistic Wholeness Institute. There's no lifestyle change or physician-grade supplement that can fix my broken arm. Take me to a hospital with a skilled surgeon. But this is exactly what the conventional system has proven to be good at: acute crisis care. Research shows us that it's not the best approach for a proactive approach to wellness. There are 4 pillars of health: nutrition, fitness, hormones, and detoxification. You're watching our webinar because you are looking for a solution to your healthcare concerns, and perhaps you've already tried to fix things on your own. At our clinic, we customize programs of care for our members to not only uncover the true underlying cause of their health issues, but also to empower them to take control of the pillars of health in an easy-to-follow, individualized manner. Let's explore how these pillars relate to thyroid health. Thyroid is a hormone of great interest to a lot of our patients, as we see many people with hypo or hyperthyroidism. Then we'll segue into a discussion on autoimmunity, since the two issues have a great deal in common. Common symptoms of a thyroid disorder include fatigue, weight gain, thinning hair, cognitive problems such as brain fog or poor focus, insomnia, depression, anxiety, or feeling overly emotional, chronic pain. In fact, many patients diagnosed with fibromyalgia actually suffer with undiagnosed or poorly managed thyroid disorders, and just generally feeling terrible. These symptoms are not just minor annoyances. Women and men with thyroid disorders feel terrible physically, and this impacts so many areas of their lives, from relationships with spouses and children, to productivity at work, to the ability to exercise and recover well. Conventional medicine's approach is to medicate thyroid patients with a synthetic thyroid hormone replacement. But this approach does not address the underlying reason why someone isn't producing enough thyroid hormone in the first place. To understand a functional approach to thyroid disorders, we need a quick lesson in thyroid metabolism. The hypothalamus sends thyrotropin-releasing hormone to the pituitary to stimulate the release of thyroid-stimulating hormone from the thyroid. TSH then triggers the thyroid to make T4 and T3. To better understand this, let's use a metaphor. If your body is like a car, T4 is crude oil and T3 is gasoline. You can't use crude oil to fuel a car. It has to be converted to gasoline to be useful. Most of the crude oil, or T4, produced by the thyroid is sent to the liver, where a good majority of it gets converted to gasoline, or T3. A lesser amount is converted into inactive T3, and another portion is sent to the intestines. In the gut, If under the presence of good bacteria, there's even more conversion of the thyroid hormones into usable gasoline. On a practical level, what does this all mean? Here's the point to really pay attention to. If your doctor is just testing TSH, all you really know is how much your brain is telling your thyroid to do something. TSH levels don't tell you if your liver or gut is doing a good job of converting the crude oil into gasoline. And most importantly, testing and treating based on TSH levels does a huge disservice to the patient, as it makes them focus narrowly on the thyroid gland instead of taking a whole body view. If you have a thyroid disorder, you must ask yourself questions such as, how is my gut health? Is my liver detoxifying properly? Are there other hormones out of balance that are impacting thyroid metabolism? And most importantly, why do I have this problem in the first place? The most critical thing to know regarding your thyroid condition is that 90% of hypothyroid cases are due to an autoimmune disorder, mostly a condition called Hashimoto's. So simply taking drugs like Synthroid, levothyroxine, or MP thyroid does not address the underlying problem, which is your immune system is attacking and breaking down the thyroid. This is a great segue to discussing autoimmunity in general. We are told in the conventional model when it comes to autoimmune disorders, it only gets worse. There is no known causes other than just you're unlucky due to genetics, and that you need pharmaceutical drugs. As a result, many people end up thinking, I'm stuck with this and there's nothing I can do about it, so I have to rely on the drugs to manage my symptoms forever. So what is an autoimmune disorder? An autoimmune condition is where the immune system sees a specific tissue as a foreign invader and starts to attack it. Here's another metaphor. Imagine you come home from work, there's a burglar in your house. You panic and call 911. Instead of sending a few police officers, the SWAT team is unleashed. The SWAT team arrests the bad guy, but in the process, they had to kick down doors, broke a lamp, and even knocked over your new flat screen TV. They did their job, but they destroyed the house in the process. This is exactly what happens in an autoimmune condition. The immune system is in hyperdrive, attacking what they should leave alone. What causes an autoimmune condition? In the conventional mindset, the answer is often genetics. But it's important to consider what factors trigger this genetic expression. We can't control our genetics, but we can control the environment we function in. Factors like hormonal imbalances, infections, food sensitivities, gut health, and the inability to detoxify chemicals play a major role. One trigger is gut health. If your gut is damaged, you can develop intestinal permeability, more commonly known as leaky gut. Leaky gut is exactly what it sounds like. The gut has become damaged or porous, and tiny particles can pass through. This causes an immune response and chronic inflammation, and generally makes you feel miserable. Hippocrates is credited as observing that all health begins in the gut. Modern research supports this antidote. In fact, numerous studies link gut health to overall wellness, brain health, weight, cardiac health, and even your ability to control blood sugar levels. To address an unhealthy gut, you must look at the underlying causes of the problem. You need to understand what foods or even infections trigger your gut troubles, and it's typically different for everyone. Focus on an anti-inflammatory diet, enhance circulation to the gut, minimize stress, and repair the intestines with targeted supplementation. Another common trigger of autoimmune conditions is exposure to chemicals and trouble with detoxification. Various organs have to process chemicals. Due to genetics, some chemicals are not processed effectively and will lodge themselves in tissue, triggering the immune system to overreact and attack the chemical and the tissue it has attached itself to. This goes back to why a holistic approach is so important. You must address the underlying factors of autoimmunity. Your autoimmune condition is not just about your immune system, it's about the body as a whole. If you have an autoimmune disorder, you have at least a 25% risk of developing more. Your body is in a state of attack and primed to break down other tissue, so simply addressing your symptoms is not enough. These are just some of the things we look at when considering the true underlying cause of a member's health issues. It's probably becoming pretty clear why you've struggled to get answers in the conventional system. But let's take a moment to discuss how America's healthcare system is truly handcuffing both patients and practitioners. Imagine a sink is overflowing and water is spilling all over the floor. Conventional healthcare runs down the hall, grabs a mop, and starts to mop up the floor. When the blood pressure goes up, a patient is prescribed high blood pressure medicine. When cholesterol is up, they get a statin. When they can't sleep, they're prescribed a sleep drug. Meanwhile, the sink is still overflowing because nobody has turned off the faucet. In the U.S., we spend more than $400 billion a year on pharmaceutical drugs, more than any other country. And while some of these drugs are life-saving, of course, many come with serious side effects, for which patients are prescribed more drugs. In fact, senior citizens fill between 9 to 13 scripts a year, taking an average of 5 to 7 drugs at a time. The conventional approach to inflammation is medication, rest, and surgery when other options don't work. Your doctor may prescribe corticosteroids, cortisone, or prednisone, but long-term use of these drugs can cause diabetes, high blood pressure, weight gain, osteoporosis, and more, all the problems that will just create more inflammation. We throw money and prescriptions at health problems, and it's not making us any healthier. Among high-income countries, we rank worst in terms of health outcomes, equity, and quality, and we have the highest rate of death due to medical error. Physicians on average see their patients in 15-minute blocks, sometimes double-booked, because primary care physicians are paid both by their employers and insurance companies, mostly in a per-visit model. They have one eye on you and one eye on the clock. The system rewards doctors who see patients in bulk. We want to make it clear we're not bashing these medical doctors. They are in general very passionate and care deeply about patients. We're concerned about the system they must operate in. Insurance reimburses for the system we just described, but it very often does not cover the things that common sense tell us actually creates and ensures health. It doesn't pay for a real education for how to manage your own condition. It doesn't help pay for healthy, wholesome foods. It usually doesn't pay for a gym membership. Insurance also heavily dictates what can and cannot be done to help a patient. One of the most common phone calls we get at our clinic is from new members who say, "I feel really terrible, but my doctor ran blood work and said I'm normal, so I'm looking for someone who can truly help me understand what's happening in my body." Being told you're normal when you feel terrible is so frustrating, but here is why it happens. The blood marker's reference range is defined as the values that 95% of the normal population falls within. And that range is determined by collecting data from all the lab's results. But you don't get your blood work done because it's a beautiful sunny day and you feel awesome. You get it drawn because you feel terrible. So normal is based on an unhealthy population. Functional ranges are tighter, based on studies of people who feel great and have no health issues. In our clinic, we also test more or different lab markers. For example, most doctors in the conventional medical system only test one thyroid marker, thyroid stimulating hormone, as insurance typically will not reimburse for further testing. But this is an inadequate marker for overall thyroid status and does little except aid the doctor in determining how much synthetic thyroid hormone they should prescribe. Again, not addressing the underlying reasons why a patient is suffering with hypothyroidism. At Holistic Wholeness Institute, one of our core philosophies relates to why versus what. Conventional medicine is worried about what you have: hypothyroidism, diabetes, hypertension. At our clinic, we know a proper diagnosis matters, but we're also concerned with why someone has that problem. If you don't ask the right questions, or ask any questions at all, you don't get the answers. All you get is a disease-drug model of care. And research tells us this mindset does not result in greater health. To get onto the path to wellness, it's important to treat the whole person with a clearly defined path. Let's discuss getting started with the Holistic Wholeness Institute. Everyone always has so many questions about what we do, so we start you off with a free 15-minute consultation. We want to make sure that we're a good fit for what you need and that you're a good fit for our programs. We want to learn more about what you're going through, what your goals are, and begin to uncover what other practitioners have missed in the past. We can also answer any questions you have at this time. If you are a good fit for our clinic, we will then schedule your initial practitioner appointment. This appointment can be done in person or on Zoom. Typically, this appointment is $287, but because you've received so much pre-education by watching our webinar and doing the free phone call, it's discounted to just $87. If your spouse or significant other needs our help too, we block off a longer appointment time and do both of your wellness consultations together for $134. There are a couple of reasons why we do this initial wellness evaluation for only $87, as $87 does not begin to cover our practitioner's time. The first reason is that we want to remove any financial barriers for you coming in to see if we're a good fit for what you need. You will be the only patient on the practitioner's calendar for that hour. They will come prepared for your specific case, and their focus will be on you. $87 reserves your spot. There are a couple of rules for the appointment. Come on time and complete your paperwork in advance. This ensures you get the most time with our practitioner. Additionally, for your wellness evaluation, we ask that you bring your spouse or significant other to the appointment, even if they aren't being seen as a potential member. There is so much information sharing and decision making in that first appointment that it's crucial to have your spouse present, as it's hard to go back later and relay it all to them. So we ask that you not only bring them to the consultation, but also have them watch this webinar beforehand so we can dive right into discussing your case in specifics at the appointment and not have to spend our valuable shared time doing this pre-education. Common questions. The first is, do you take insurance? No. Insurance does not cover what we do. Insurance covers the conventional system, which, as you already know, does not have the answers you need. The second is this affordable? Yes. We work with many different types of people, from retirees to single parents. If this is a good fit for you, we will find a way to make it work for your budget. Another question is the diet weird or exercise hard? Absolutely not. We believe in teaching people sustainable habits they can practice their entire lives. Nothing weird, we promise. Everything we recommend is grounded in the latest science. Do you have to be local? We're located in New Jersey, but we work with people long distance all the time, which means we can not only help your mother-in-law who lives out of state, but also we can talk with you over the phone if you can't always make it into our office for appointments. Last but not least, we urge you to stop procrastinating and come in for this initial consultation. Most people spend months, if not years, pondering major life choices before taking action. What is lost in the downtime is a more vibrant, healthy life. We cannot wait to meet with you and guide you along the path to wellness. Submit your contact information using the form on our website, and our team will be in touch with you to book your consultation. Thank you for watching.